Howdy, folks. Sean Adamson, the Rehab and Documentation Guru. It's been a while, but I got an email from someone who took one of my courses or has taken more than one of my courses, and I thought I would just address it in a video because, frankly, it's quicker than typing up a response. Also, the question that she asked, I've heard some iterations of it in the past, and I know it's a question that other people have. And so I wanted to just go ahead and do a live about it. So I was asked by a therapist, I won't say her name or her location. Um, she has been told by her boss to avoid certain codes. So, for instance, manual therapy, 97140, I believe. I'm just going off the top of my head. And I think a Therex 97110, and was told to just focus on billing two particular codes. So I've heard various iterations of this particular question. Is my boss right? Should this be something I'm avoiding because insurance is not paying for them? That type of thing. And first of all, I don't want you to get in trouble with your place of employment. I'm not looking for you to start a fight with your employer. However, I will say the vast number of times I've heard this particular scenario played out, which has been a lot, because I've got a chance to speak to a lot of therapists. And I'm getting ready to teach a course tonight on therapeutic activities through Allied Health Ed. And I wouldn't be surprised if I get that question yet again. My boss said, don't bill this code. And first of all, I would say it is likely, just based on experience in these scenarios, that your boss is not correct. They they're not only providing inaccurate information, but perhaps they have an inaccurate understanding of the situation. So, what can happen for some organizations is they can get sorry about that, denials related to a particular code. So, let's just say Medicare, and this is a Medicare scenario that this young lady was pointing out. Medicare targets your entity, your organization, for one code. And we'll use the example of therapeutic exercise. And so they just deny across the board, let's say 20 patients that they have reviewed with improper billing of therapeutic exercise. And so now the reaction of the boss is to say, don't bill therapeutic exercise. Now, my first question would be, is this payor, Medicare for instance, no longer paying for therapeutic exercise? This should be the first question. And I would want documented proof that that was the case. Now, it's not the case. I mean, I'll just tell you right up front. 97110 therapeutic exercise is a covered service. It's on Medicare's national coverage determination. It's listed on the local coverage determinations of the MACs. It's not going away. So, with that said, I would want documented proof that this is a code we have to exclude. The other, thing is you're going to be experiencing patients that have managed Medicare plans. And again, the managed Medicare plans are required by law to provide at a base minimum all the services that a Medicare recipient receives. They can provide more, but they can provide less. And so I would ask for documentation proving that this is an order from entities like CMS or Humana or Aetna. And I'll guarantee you 99.99% of the time they wouldn't be able to produce anything like that because it didn't happen. What are they doing? They're reacting to a slew of denials. Um, with that said, sometimes there are challenges to getting paid for certain codes. So, for instance, if you're targeted, let's just use the therapeutic exercise example again, where they don't want to pay for therapeutic exercise on 20 different charts. It's probable, it's likely, and I used to do auditing for large organizations, that all 20 of those charts did not have adequate documentation to support therapeutic exercise as a billable skilled service. TheraX, by definition, deals with strength, flexibility, range of motion, and endurance. Those are the four key things that the CPT code was developed for. There are other things that can be used according to what the insurer says. They'll stipulate certain criteria for coverage. But the big thing is, was it skilled? Was the application of an exercise skilled by a clinician that has advanced knowledge, advanced licensure, is billing insurance for an expensive code? Because, I don't know what the code is off the top of my head, but let's say it's 30 something per 15 minutes. That's expensive. It adds up quick. And so your boss is likely reacting to the denials that are occurring because of bad documentation. And that's it. That almost every single scenario I've faced with questions like this has been just unsupportive documentation. It did not meet the standards of proving medical necessity. Let's go through 4 words. And in fact, I'm going to be working on developing a course specific to this. Safety and effectiveness, reasonableness and necessity. And I've covered these in videos that I did not too long ago. Safety and effectiveness. Safety and effectiveness of therapeutic exercise, just continuing on that example, has been proven through literature, through research for a long time now. That's why it's FDA approved. That's why it's a CPT code that insurers recognize. But when it comes to safety and effectiveness, as far as skilled service goes, can you prove in your documentation that only you could have safely done the therapeutic exercise with the patient? And so that deals with the complexity of the particular patient. And effectiveness. Does your documentation over time show definitive progress in the areas you're saying TheraX is needed for? So if you're measuring strength, range of motion, flexibility, or endurance, whatever that measurement is, you make sure you continue measuring it so that you prove clinical effectiveness. Now, obviously, some of you are familiar, if you've watched my channel, with maintenance therapy, and you know that Medicare does not pay on the improvement standard anymore. They're not supposed to, at least. But if your goal is for improving a functional defect area and it's tied to strength, let's say, and you're not making strength gains and the function's not getting any better, then you're not really demonstrating a rehabilitative care plan. So you might need to have a maintenance care plan, which the doctor has to sign off on, right? So they're going to be looking at safety and effectiveness. Could only you have done it safely? Was it truly effective? And then is it reasonable? So reasonable care means it's cost effective. And one of the things the reviewer is going to be looking at is, are your outcomes showing a good cost benefit analysis compared to just having a restorative aid or a CNA or a loved one or a patient self-administer the exercise program? Could it have been reasonable to pay less money to get the same outcome? That's another thing you got to prove. And then necessity kind of goes back to that safety part. Is it clearly necessary that your licensure and your billing of a third-party entity was necessary to make the progress in that area? And so those 4 words, safety, effectiveness, reasonableness, and necessity, those are the key words related to all medical documentation. And I think, if you've watched my channel before, I'm currently working in the field of access management, mostly related to pharmaceuticals. And a lot of those procedures are much more expensive than therapy services, astronomically more. But it's all the same stuff. Um, all those 4 words apply still. And so when I'm writing, let's say I'm helping with an appeal, I helped with an appeal just last night. Uh, that was what I was focusing on. Even though it's a high dollar amount compared to therapy services, it's still the same thing. It's not rocket science. And if you can focus on those 4 words, there's no reason, and you understand the definition of the CPT that you're doing, manual therapy, TheraX, whatever it might be, and you follow that definition to the T, and you demonstrate those 4 words, there's no reason you shouldn't get paid, period. And again, there's no reason that your boss should probably be telling you to avoid billing for that because it's legit. Those are legit services, TheraX and manual therapy. Anyway, hope that helps. Don't get in a fight with your boss. Take care and God bless.